Yes. That's when you know it's official. That's great. It does take a couple of awkward minutes while they do join. And I don't know about you, but I'm really feeling like spring is in the air and the birds I'm hearing, the sun felt lovely today. That's so exciting.
It's a nice reminder that it's coming.
Yes. All right, well, let's jump in because tonight is an information-packed webinar. So good evening. Thank you for joining us for tonight's educational webinar, which is funded in part by the Lee C. Rosenthal Memorial Education Fund. I'm Christina Thompson, Director of the Coalition. We're grateful for this support from this fund, which allows us to bring meaningful and informative programming to our community. Tonight, I am really excited to welcome back Leslie James, a longtime friend of the Coalition, a dedicated advocate for integrative health. Dr. James has recently transitioned to a direct primary care practice for women and has achieved certification as a diplomat of the American Board of Lifestyle Medicine. Her expertise in integrative and lifestyle medicine makes her a valuable resource for this discussion tonight. And while I want to really give her the majority of our time, just a couple of housekeeping notes. Closed captioning is available for anyone who needs it. So please access this feature at the bottom of your screen. The webinar is being recorded and will be available on our website tomorrow. Rachel's going to help me by dropping the link in the chat here as to where you can find it. The slides that Dr. James will be referring to tonight were sent out in advance, but if you didn't receive that, we have a link for it here as well. So tonight, please enter the questions into the chat that you may have for Dr. James. You can put those in at any time. Rachel Rosen Simpson will facilitate a Q&A session following the presentation and will hopefully answer as many questions as time allows. But thank you all for being here. We look forward to an enlightened and engaging conversation. And I just want to turn everything over to Dr. James.
Thanks so much, Christina.
Of course.
All right, we're good? Yeah.
Beautiful.
Well, it's a pleasure and honor to be asked to give a talk to the Breast Cancer Coalition. And I really had misinformation on my mind when Christina had mentioned the topic of nutrition and supplements. So thank you all for actually submitting your questions ahead of time too. That was so helpful, and hopefully I get most of your questions answered tonight. So Christina mentioned a little bit about me. I have really been a champion of preventive care, and especially for women, for most of my career. I opened an integrative practice in 2011, and oncology patients just started to show up. So, and I really feel like there is this gap between sort of oncology care with oncologists and then the whole person. And so that really has been a lot of my focus. I have gone to multiple meetings and been a member of the Society of Integrative Oncology and belong to the Integrative Working Group, really always just trying to find more information for my patients and how to facilitate their care. So health information has been a lot on my mind. It has been heartbreaking, and the alarming trend and the alarming rate about which this information is out there has been a concern. It's not only harmful to the health of the individual and public, but well, yeah, I mean, it can be disastrous. And it's complex. I mean, it's taken decades to sort of get here. But what I want to focus a little bit on today are, answering some of the questions, sort of correcting some of the misinformation, and having that science is a process. It's evolving. So it's not a static thing. So just keep that as a reminder. So I have the questions in my slide. So I grouped them. So there were a lot of questions about menopause, and thank you, because no pun intended, but this is a super hot topic on social media right now. And while it's great that women are getting attention, people are listening to their symptoms, there, however, is just, a lot of misinformation out there. Hormonal therapy being touted as a cure-all for everything. And so thank you for the questions. They were so timely. So just a little bit, perimenopause is the year leading up to menopause, can begin in the 30s and 40s. There's a lot of hormonal fluctuations. Menopause, the transition, it's interesting that we kind of diagnose it retrospectively. So we look back and say, yeah, that was your last period. And when 12 months have gone by, we give the diagnosis of menopause, if you will. And there are multiple stages of perimenopause and menopause. And so it's not just sort of a, simple, you just losing your estrogen, you have some hot flashes. It is a very complex transition. So a number of the questions were related to menopause and cancer therapy, around like, would that push people into menopause? When could they expect to resume? And really, a lot depends on the person. And it really depends on how close in age women are to natural menopause when they're diagnosed. Depends on their diagnosis and treatment. Certainly, a number of therapies can push women into menopause, and many never have a period after that. Some sometimes can resume. There's also the intent of treatment. So in some cases, the intention is to create a menopause. So surgical menopause can be that way. So, I can't really answer specifically, but it does depend on a number of things. So what about weight gain and menopause? Well, first of all, I want to point out that it's not uncommon for women to gain weight through breast cancer treatment. So following the diagnosis of breast cancer is very common to gain weight. This was just started to be described like in the late 1970s. And it's really unclear the cause. Some of this may be treatment related, some may be related to a change in activity levels, but it's really not uncommon to gain weight. Unfortunately, patients rarely return to their pre-diagnosis weight, and typically the weight range ranges from 5.5 to 13.7 pounds. Weight gain and menopause, interestingly, both men and women gain weight as they age. Weight gain during the menopause transition seems to be related mostly to aging and lifestyle changes, but there are changes in body composition that are described and noted. So typically there's a loss of lean muscle mass, so muscle, and an increase in adipose tissue and a shift. And many people, can tell you, yeah, like I'm gaining weight right around my middle. This is sort of visceral adipose tissue. And so when we lose muscle mass, our metabolic rate decreases. We're not able to burn as many calories. And then also there is an additional change in metabolic rate. So you're going to hear from me multiple times through this talk about weight bearing exercise, about resistant exercise, and exercise that builds muscle. So many people ask, and typically women who have had a breast cancer diagnosis don't typically are cautioned against or advised against using hormone therapy. But just in case you felt like you were missing out, hormone therapy for weight gain it's not recommended for weight, to mitigate weight gain in menopause. And interestingly enough, studies, the postmenopausal estrogen progesterone interventions trial, the Women's Healthy Initiative, they actually showed no difference in weight with hormone therapy and without. So the North American Menopause Society position paper recommends against using HRT to mitigate weight gain during menopause. And then I just wanted to draw attention to the North American Menopause Society, I think now they go by Menopause Society, they recently just put out a position paper on misinformation. And this was because so many practitioners are experiencing incredible frustration with the amount of information released in social media, by influencers. And even so much lately, I'm seeing people recommend estrogen cream for a face, testosterone pellets. And so they really thought it was important to start to put this information out. So this is their position paper in a response to misinformation. So what can we do about weight gain during menopause? And what I would say is, first and foremost, I would start with lifestyle interventions and then work through this in a stepwise fashion, working on diet and exercise, looking, weight loss programs and medical interventions, maybe something that could be considered as well. And looking for practitioners who are knowledgeable and able to help. American Board of Lifestyle Medicine physicians certainly are experts in lifestyle medicine. American Board of Obesity and certification practitioners can help with medical weight loss programs. Lots of questions about sugar. How bad is it? And is it feeding cancer cells? Well, just to go over a little bit about what we're talking about when we talk about sugar. So table sugar is fructose and glucose. Added sugars are there are many forms of added sugars. So I'm going to be talking a little bit also about added sugars. So these are sugars that are added to products. They come in many names, agave, beet sugar, dextrose, and so to be on the lookout for those. Refined carbohydrates are highly processed carbohydrates. So typically like baked goods, things that use like white flour in the cooking, pastries, cookies, things like that, and then high fructose corn syrup. So when we talk about feeding cancer, the theory seems to have arisen from the idea of the PET scan. And so a PET scan is when radioactive tagged glucose is used. It's injected into the body. And then when the body is looked at, we could see areas light up. Tumors appear brighter as they are metabolically more active. So that doesn't mean though that the cancer is that sugar feeds cancer. Yes, cancer uses sugar like other cells do. It's just that the rate that it uses it is higher. So I don't know, I kind of sort of think about it if I have like a toddler and a teenager in a house and I couldn't see like who was eating what. Well, it's really like about the metabolic rate, not like what's feeding them. They're both eating the same thing, but one has way higher metabolic rate. If you've ever had a teenage boy, you know that. It really, so no, it's not true in that sense, in this sense. However, sugar is associated with cancer, and we know the average consumption of sugar in the US is higher than the WHO, the American Cancer Society, the American Heart Association recommends for daily consumption. And we know excess sugar is associated with the development and progression of cancers. We know higher consumption of sugary beverages are associated with increased what are called cancers that are related to adipose tissue. And almost no, nutrition guideline. I don't know any nutrition guidelines that would recommend adding sugar. There's really no health benefit. Most guidelines recommend limiting or avoiding sugar. Many of the patients we see have prediabetes, impaired fasting glucose, which also increases their risk of cancer progression. So, you know, no, yes, it's not true that sugar feeds cancer, but sugar is associated with cancer. The WHO recommends that adults and children limit their daily sugar intake to less than 10% of the calories in their diet, and actually optimal is really less than 5%. So if you're on a calorie, if you eat 2,000 calories a day, so that would be like 6 teaspoons of sugar. So my limiting added sugar is really the advice of almost every single health agency and nutrition recommendation guidelines. And as I said, these added sugars come in, they might be cane sugar, high fructose sugar, coconut sugar. So really what you want to do is look at the label. You'll see like the total sugars, and so it will include naturally occurring sugar and then what's added to it. And ideally, what is added should be 0. And when we talk about carbohydrates, so carbohydrates, is a group of what are called, macronutrients. And we know them as they can be, whole grains, fruits can be carbohydrates. And to be honest, like foods contain, a mixture of things. So legumes can be carbohydrates and protein. But they are generally things like grains, fruits, and vegetables. And they get broken down into glucose in our body. And the beauty of whole food carbohydrates is that they come with so many other things. They come with vitamins, nutrients, and fiber in them. And so when you can, you really want to focus on whole food carbohydrates and limiting added sugar in the diet. So which leads us right into the next question of the keto diet. Is there any truth that a keto sugar-free diet helps reduce cancer recurrence? And so a ketogenic diet is a diet that mimics the effects of fasting. It's high in fat, low in protein and carbohydrates. Medically, it started to be used to treat medication-resistant epilepsy, and particularly in children, and it's still being used for that. We have started to see it sort of show up in the oncology world. I remember being at a conference, at the Society for Integrative Conference, and it was at Dana-Farber, and they had a talk on fasting and a talk of ketogenic diet. It was about 10 years ago, and so fascinating and so interesting. I mean, and these are, still, honestly, these treatment modalities are still in fairly early phases, but interesting. So the use of a ketogenic diet was first came to be known in the oncology world with treatment of malignant glioblastomas, which are highly metabolic tumors. I would say there are very interesting and ongoing studies. They're small, so very small studies. They, maybe 20 or 30 people per study. There's also animal studies. They're very early. So, in the phase 1, phase 2, phase 3 of trials, we're kind of in the phase 1, phase 2, like, is it safe? Is it, something that's not going to harm patients? So that it's hard to make great recommendations from that. I'd say it's interesting. Let's keep our eyes on it. One thing with a ketogenic diet, it may increase cardiovascular risk, which actually is the leading cause of death for women and men. And so there's that to keep in mind. But some of the interesting studies are around using the keto diet during radiation, using the keto diet during treatment to prevent treatment side effects and enhance therapies. The studies are mixed. I mean, there are some negative studies. Recently in mice, there were a few negative studies. One, that it increased aging and senescence. Two, that although it helped with tumor response, there was increased metastasis. So, they're not ready for prime time to roll out with blanket recommendations. As is fasting. So does fasting help cancer patients with cellular turnover? I mean, so the mechanisms of fasting are thought to affect lots of biochemical processes. And interestingly, where the idea to start fasting for cancer came about is that we know that when we calorically restrict, in animals, it's much easier to do this, that we see sort of increased longevity, decreased cancer. So the just global caloric restriction, however, it's like not really, humans have a hard time with chronic caloric restriction. So the fasting mimicking diet is something that sort of showed up, and that is really fasting around chemotherapy. So initially it was a full fast, and then Walter Longo developed it's a food, functional food that comes in a package that mimics fasting. Is very low calorie, and it was meant to be taken sort of before and during and after shorter chemotherapy sessions. And the goal was to enhance the treatment response and decrease side effects. And so there is one ongoing study that's enrolling. It's a placebo-controlled study, and it should be, I think it's in a year. It should be done in a few years. I think that will give us much more data. It's in women with ER-positive breast cancer. So this fasting mimicking around breast cancer, so we'll have much more data on that. So what I could recommend, and this data comes from the Women Healthy Eating and Living study. So it was a study that looked at a large population of women, and it actually looked at their diet history. So it looked back, and what we saw was women who fasted for less than 13 hours, they had an increased risk of the recurrence, where women who fasted for greater than 13 hours showed lower hemoglobin A1Cs. And interestingly, they slept longer. So, maybe they stopped snacking and they went to bed. And so they had longer sleep. So, we're not sure what, is responsible for the outcome, but we can say 13 hours is a reasonable time to fast overnight. So then I'm going to move on to osteopenia and osteoporosis. And the question came, are there foods and supplements to combat osteopenia and osteoporosis? So just a little overview, 54 million people in the US either have osteopenia or osteoporosis, half of all women over 50 and a quarter of all men. So the aim of treatment is really, and the aim of treatment for osteoporosis currently is to prevent fractures. We don't have a cure for osteopenia or osteoporosis. And unfortunately, bone loss can be accelerated or induced by some cancer treatments. So this is where this is my health announcement, because all of you, I'm sure, have young relatives, teenagers, and really formation of bones and building bones happens, we can do the most to prevent osteoporosis when we're younger. And so we reach our peak bone mass, really in our 23 to 30. And then as estrogen drops, as we go through menopause, the rate of bone loss accelerates. And so women can, during menopause transition, lose 10 to 20%. And that's like 1 T-score of their bones. Again, I'm going to plug muscle mass, improving muscle mass with strength training can help here. But I'm going to move on a little bit to talk about calcium. So, and I link these together because they're related. So what is the amount of calcium? What calcium supplements should we be taking? Calcium supplements versus food? Great questions. So the recommended daily allowance, the RDA of calcium for women over 50 is 1,200 milligrams. It's 1,000. From 19 to 50, it's 1,000. And for men over, I think, 70 or 75, that's when they get to the 1,200 milligrams a day. Most experts recommend obtaining most of this, if possible, from food. However, 42% of Americans fail to reach it. Calcium is listed as a shortfall nutrient. So, there's a number of nutrients that many Americans don't, fail to reach adequate amounts. That's calcium, iron, potassium, and fiber. Those. Interestingly, some new guidelines just came out from the U.S. Preventive Task Force, and this is regards to people, the general population, so not people who have osteopenia, not people who have osteoporosis, and their guideline was against vitamin D and calcium for the prevention of fractures. So it said, like, if you're over 60, don't have osteopenia, don't have osteoporosis, don't take vitamin D or calcium. And, it's interesting because maybe it's like, because you think like all these people are not getting enough calcium, like, what is this? No recommendation about taking, but I would just, the thoughts are that maybe it doesn't really have as much of an effect later on. So that's my plug for, calcium and bone strengthening in younger adults. So calcium and you do need to take calcium if you are on medications for osteoporosis. So if you have osteoporosis, you have osteopenia, you should be getting the 1,200 milligrams of calcium. So you need adequate calcium. Does it have to come in a supplement form? It does not. Interesting study. This was a long study, a placebo-controlled study that did show a reduction in cancer mortality in women with breast cancer who took calcium. However, an increase in cardiovascular mortality. Overall, the mortality was the same, so it sort of was a wash there. But if the thought is that we may be getting, like, too much of a calcium supplement may not be good for our hearts and our vascular system. So it's best to get most from our food and aim for no more than 600 milligrams in a supplement form. So, and it is not, it is totally doable to get this amount of calcium from your diet. I have one lovely patient who started tracking her calcium. And, you just have to do this over a few days to figure out how much you're getting in your diet. And you can see that it's actually not that difficult to get calcium in your diet. So calcium sources, how bioavailable is the calcium that we're eating. So what I mean by that is, so if you, say there's 300 milligrams and it's only 30% available, you're only going to be getting, a certain percentage of that. So dairy is 30% available. So, but interestingly enough, bok choy is 50% available. So like a cup of bok choy, or 50% of that, the calcium in that bok choy, you will absorb. So when we look at plant foods, they may have less calcium overall, but many of them you're able to absorb it better. So just put that out there. The only thing is that spinach contains oxalates, which and some other vegetables contain it. So they're almost like anti-nutrients. So they do kind of interfere with the absorption of calcium. But calcium fortified orange juice, calcium set tofu, they have great amounts of calcium in them. And I'm just going to put a plug. I have no shares. I stumbled upon this organic silk milk. It's, in the green container. There's 300 milligrams of calcium per cup in that organic soy silk milk. So you can easily get calcium in your diet. So supplements. The questions here were, are there reputable studies that exist? And I'm sure people hear from their oncologists different things about supplements. And, what I hate to see is that when patients get sort of triangulated, where, one person is telling them this and one person is telling them something else. So when we look at supplements, one thing I want to point out some things. This is a for-profit industry approaching $1 trillion. So there's a lot of marketing, a lot of push, and interestingly enough, most of the supplements you see on the market are really owned by about 14 companies. So this, just, to keep in the back of your mind, it is a for-profit industry. The regulation and safety issues are different for supplements than medications. Supplements are put on the market. It's up to sort of the manufacturer to, sort of on good faith, put products out there. They have been found. There are products that can be contaminated from time to time. Look for products that are third-party tested, meaning that the manufacturer lets someone else test their product, and often you'll see that label on the supplement if you're taking them. There are side effects to supplements. We do see elevated liver enzymes, hepatitis, liver failure, from some supplements. So those things do occur. And I would say we're seeing more of these case reports in the literature, maybe as, people are taking more supplements. And there definitely are possible interactions. So with medications and things like chemotherapy. So we want to make sure, supplements and medications both have different pharmacokinetics. We want to make sure that they're not using the same pathways to prevent any kind of interaction. So possibly we could make our treatment less effective, or we could make it more toxic. So these interactions do exist. Supplements come in all different forms, vitamins and minerals. Botanicals and herbs or herbals, they tend to be the riskiest in terms of interactions. Things like, and notoriously like St. John's wort, garlic, green tea extract, turmeric, they can interact with certain medications. They can cause things like bleeding. And then enzymes, amino acids, melatonin, protein powders, and fibers are also included in supplements. I don't have like blanket, go-to supplements that I could tell, just anyone could take. How I would approach it is a very curated way. So we can use supplements to treat deficiency or insufficiency. So certainly when someone, has a vitamin D deficiency, when someone has a B12 deficiency, that is, we're going to treat them. Where I feel like I like to use supplements the most is really in treatment-related side effects, quality of life, for short things like short periods. And just for example, if someone has joint pain, instead of going to, a sort of a riskier drug, like maybe like meloxicam, I might try something like turmeric or boswellia ahead of time and see if we can sort of reduce some of that pain and maybe reduce the medication that's needed. Or if someone's coming off a proton pump inhibitor, I might use a supplement to help them in between that. But it's always in like being cognizant of treatments, what people are, what treatments they're taking. Really good guidelines for the Society of Integrative Oncology has guidelines for um, treatment-related side effects. They have guidelines for supplement use. So there's a lot of great resources there. I think when you ask the question of reduction of risk and reduction of prevention, those are trickier. And really, I don't see good data for long-term use of supplements for risk reduction. And partly because, I mean, those are very long studies to do. We're talking, it could be decades. I have not seen a study like that. So I would be interested to see it, but I think we don't have great data for that. I would also say that I am someone who wouldn't, I think someone should be following you. With certain supplements, liver enzymes do need to be checked. We need to make sure even things like green tea extract or even large doses of green tea can elevate liver enzymes. So I do check those kind of things. And I think having someone monitor or help you with that is important. So one thing I do want to point out too is supplements, micronutrient inadequacies, high and low doses. So this is called a U curve, and there really is a sweet spot for almost all vitamins and minerals. We know that being deficient or having insufficiency can lead to health outcomes, but in almost all cases, too high a dose is problematic. And we see that with calcium, with vitamin D, vitamin C. I mean, all of these things at high doses can be problematic. So, more is not better, and if you typically it's the recommended daily allowance or the daily amount that would be needed. And interestingly enough, I think we can also see this with botanical herbs. I sat in this great lecture about using mushrooms in breast cancer. It was a mouse study, but there was this U-shaped curve. And so right now we're figuring out what the sweet spot for a lot of these herbal products, is tricky. And I think we're just not there yet for a lot of them. So timing is really important. I typically don't recommend many or any supplements during chemotherapy and radiation. Antioxidants during chemotherapy actually there have been studies that show that may decrease the risk of survival. They can interfere with therapy. So that is true. I mean, there is, I guess there would be the question of, well, how many oranges you can eat and things like that. So I really focus on a healthy diet during that time and try to avoid supplementing. And, I think the focus, I like to focus more during survival, we can start to talk about these things and using them, but there truly is a potential to have an interaction. These are critical medicines at critical doses. And so I think that it's not the time to be adding supplements in. Pre and probiotics. What are the recommendations for cancer patients? Is it better to get this from yogurt or kefir or a supplement? So just to go over, we're talking about probiotics, prebiotics, because of the microbiome that we know to exist mostly within our colon and how important that is for our health. So prebiotics are plant fibers that act as food, or for probiotics. Probiotics are these living strains of beneficial bacteria. And fermented foods are contain prebiotic, the living probiotic, and then also all the things that these organisms make. A wonderful guide to probiotics is the US Probiotic Guide. So when we are making recommendations for probiotics, we make them, in general, it's best to make them for a specific issue. For example, today, someone texted me and asked me, what's a good shelf-stable probiotic to prevent traveler's diarrhea? And so, we can look at studies that look at specific strains. So the specific strain might be Lactobacillus rhamnosus GG, and we know that because we know that there's data. Are there recommendations for probiotics for general health? There's really no studies out there that taking probiotics really improves the health of your microbiome. What I will say is that eating fiber and fermented foods definitely can improve the health of your microbiome. If you have a GI issue like diarrhea, constipation, IBS, certainly there are specific probiotics that can help. And where we would go to help figure that out is the guide, and we would look for specific strains. And so just so you know, a Lactobacillus rhamnosus GG could be, there might be another Lactobacillus rhamnosus, very different. And so it has to be very strain specific. Probiotics and immunotherapy is a question among practitioners who use, supplements and in the integrative world. There was one negative study, and this is, that showed actually that the probiotic actually decreased the efficacy of the immunotherapy. And so in general, here again, I would say, it's better to get this from your food, and, limit the use of supplements during treatment. So fermented foods, they have been shown to increase microbiome diversity. There's a great lab, Sonnenberg's, they're a husband and wife team at Stanford that study the microbiome. And fermented foods include things like, and I forgot to put them on, but they're one of my most favorite, like miso, tempeh, yogurt, kefir, cottage cheese, kimchi, fermented vegetables in brine, kombuchas. So all of these, and it didn't take a lot, it was like a few tablespoons. So including a tablespoon with a meal is really enough. And if you add fiber to that, that's fantastic. So fiber and ferment are my favorite F words. And the recommendations for fiber, are 25 to 35 grams of fiber a day. And most Americans are not getting at least the recommended amount of fiber. So vitamin K2, I've heard vitamin K2 is really good for your bones. What is the dosage and what is best? So vitamin K, the K1, K2, the MKs, they're a group of molecules. And interestingly, vitamin K intake has overall declined in the last 2 decades. So half of adults over 60 actually are not getting the amount of vitamin K that they need. Low intake of vitamin K is associated with lower bone mineral density and increased risk of fracture. However, in placebo-controlled trials, recent trials, actually didn't show any benefit in supplementing with vitamin K for osteopenia or osteoporosis, and did recommend about getting it from green leafy vegetables. So green leafy vegetables and vegetable oils are the best way to get vitamin K. Vitamin K is often included in supplements with vitamin D, and generally there's no upper limit of vitamin K at this point, but generally like 190 micrograms to 250 micrograms is a reasonable dose if you're taking vitamin D. But best to get it from your food. Celiac disease it's an autoimmune disorder that affects the gut, it does have the potential it increases the potential for deficiencies. And so that is because of malabsorption. So things like calcium, often people are not getting enough calcium or iron. So then there's an increased risk of osteoporosis and anemia, and also a potential for diminished wound healing. In terms of diet, there's lots of ways to get healthy carbohydrates without eating gluten. And legumes, there are other whole grains that are gluten-free that I would recommend. Often gluten-free products have a lot of junk in them and are low in fiber. So getting fiber from like whole foods, whole grains would be my recommendation. Protein, are there differences in protein needs and what's the optimal amount? So protein requirements for Americans in general are 0.8 grams per kilogram, or if you work in pounds, it's 0.36 grams per pound. One thing, there's a lot here again, a lot on social media, like pushing protein. And so excess protein does not just jump right into your muscles. It is extra calories. To build muscle, you need a regular strength training program. Protein requirements for athletes or for, so the extra protein requirements are really meant for athletes. And so, you see a lot of trainers out there recommending high amounts of protein. This is really for like high power, strength and power athletes, endurance athletes. And interestingly, a plant forward diet or plant predominant diet, it's so easy to get enough protein. And I'll just tell you, the recommended protein I just did this morning, calculated it out. For me, based on the 0.8 grams per kilo, would be 45.6 grams. I just kind of quickly, like loosely calculated how much I got in a day. I drank silk milk with espresso. I had Ezekiel bread with peanut butter, some lima beans, greens, some tofu scramble. I got over I was at 80 grams. So that would really push me into the amount that an endurance athlete would eat. And I was not actively trying to eat a lot of protein. So it's quite easy to get the protein that you need daily. That being said, that there are extra protein needs around surgery for healing, preservation of muscle mass. In the surgical literature, the recommendations are 1.2 to 2 grams of protein per kilo. So, that is a good amount. I typically don't recommend protein powders that often, but for people who are struggling to get food in, they're struggling to get the calories in, I will often recommend a very basic, like very minimal additives, no flavor, no extra sugar, whey, hemp, or pea protein. So as minimally processed as possible. You could put that, and adding it into food to get some extra protein. So how I like to think of protein is like I want to be as efficient as possible when I eat. So when I eat something, I want all the extra things in there. So what comes with your protein? When we think about animal-based proteins, we get more saturated fat. There are vitamins and minerals, very little fiber, little to no fiber. We get extra calories, but we get the EPA and the DHA, which are the omega-3s if you're looking at things like fish. And we can see more of an accumulation of environmental toxicants. When we look at whole food plant-based protein, we see fiber. So we're getting a lot more fiber, vitamins and minerals, healthier fats, and actually generally lower in calories. So, it's a good idea to mix it up. And, if you're not eating a lot of plant-based proteins, consider trying them. And then what I wanted to talk a little bit about was really dietary patterns. When I started talking and going to the integrative oncology meetings or thinking about cancer and diet, there was a lot about, very specific nutrients. And I can remember being at a conference and like the whole lecture was about broccoli. And so we were focusing on these like high power, foods to fight cancer. And I think there's been a shift, and I'm glad for it, to looking at more dietary patterns. Because I think it's sometimes hard to think, oh, I got to eat some broccoli. Oh, I have to eat some flax seeds. But looking at this whole diet pattern together, and we know we have great data for whole foods, plant predominant diets, Mediterranean diets, with reducing mortality. And so, there's great data for that. So what a plant forward diet is minimally processed, and, it's full of things like legumes and fiber, low in processed food. So lastly, just a little bit about healthy information. I really just want to bring awareness to and have you start to question how healthy your information ecosystem is. So where are you getting your information from? Is it diverse? Looking at the evidence. So not, I see this with influencers a lot, or there's, they tout evidence, but when you go to look at it, it's animal studies. The studies are not, and I would say look at the evidence. They're very small studies. They're very short period of time. They're not controlled, and so it is important to look at the evidence and the quality of the evidence. Also, to watch out for these, red flags. It's emotional, it's a miracle, it's a secret. And if you are searching on PubMed, one tip that I would recommend is, if you punch in your query, menopause maybe, and then you would tag it with like ACOG, which is the American College of Obstetrics and Gynecology, or ASCO, the American Society of Clinical Oncology. And so if you put that in, it will help lead you to better information. Other resources that I'm really liking lately are Unbiased Science. The Vagenda is Dr. Jen Gutter. She's an OBGYN, talks a lot about menopause. I have to put a plug in for paging Dr. Fran. She's a local OBGYN. She's got a great Instagram page and she's putting great information. There's podcasts at Dana-Farber, Sloan Kettering, MD Anderson, and in the Society of Integrative Oncology as well. And I love these nerdy girls. They've just put this great information out. It's on a range of health topics, and I love what they're doing. So with that, I'll stop and take questions. I think I'm going to stop my share. Stop there.
Yeah. All right. And do we have questions for you?
Okay.
Well, first of all, thank you so much for sharing all of that. So much good information. And I know for everybody, maybe you're feeling overwhelmed. That was a lot of content in a short amount of time, even less than an hour. So as we take some time to digest, I will probably have a lot of food puns, just forewarning. All of that information. How about I start? So far, I think I have 29 questions gathered from the chat. So I figure Leslie and I talked a little bit before everybody hopped on and agreed that we would try and get through as many questions as we can before we both need to scoot. So we have, at least about 25 minutes, I would say. So without further ado, let's get started, and I'll try and also keep an eye on any more questions that come in. And also, just full disclosure, I literally just kept a document and kept adding them to the bottom. So these are in no particular order. And I apologize for everybody in the chat too, that the ones up top are the ones that were shared in advance via email. So here we go. All right. Knowing what holistic herbs coexist with cancer medicines to aid in healing and destruction of cancer cells.
I think I talked about that a little bit in the botanicals section. And so botanicals and herbals, that's a huge category of topic. And I, the data is very, a lot of it is sort of cell culture data, very preliminary data. To make a global recommendation, I would not be able to do that. I would caution people that, I'm trained as an herbalist. I love plants and I love herbs, but I would not recommend them around treatment. I think also a lot of herbs and supplements, they have a nuanced effect. They take a long, like more time. And I think that, just waiting until after treatment and then having the conversation. Yeah. For
But
general prevention, though, I really don't think there's any good studies about like long-term prevention.
okay. Yeah, and a lot of these questions,
I
it's
know. Yeah.
hard to give a blanket answer to everybody because we have such a
Right.
great turnout. So bear with us, everybody.
Yeah.
All right. Someone who is struggling with celiac and IBS, what's a good diet to get enough fiber? One of many food allergies for this person is stone fruit, which you also did address some of these concerns, but
Right. Yeah. So one is I'd make sure the celiac is well controlled. IBS, there are, there are a number of products out there. It's hard to recommend, like, I don't know where this person is in their treatment, but the US Probiotics Guide does have recommendations for IBS that could be helpful. Um, there are lots of sources of fiber that are gluten-free. There's lots of whole grains out there. There's fruits and vegetables. So those would be great ways to get fiber. Some people with IBS have trouble, with what are called FODMAPs. So sort of, maybe working through that. But with avoiding stone fruits, there's other fruits out there. Vegetables, I would say, at least 5 servings a day. That's just the daily recommended amount. Most people are not getting. So,
especially in the winter, it's hard in the Northeast. All right, let's see, where are we? Are there any studies about snacking before bedtime?
so I think I alluded to, so the fasting study showed, fasting for 13 hours. So if you snacked at bedtime and bedtime was 10, like you wouldn't be able to eat again till, so I think, if you were trying to do 13 hours of fasting, you probably wouldn't snack. But snack eating later in the day, like in terms of looking at metabolic health, um, seems so if you ate your calories in the morning versus your calories at night, it seems that like eating later at night is not as I don't know, maybe it's not, you're not as metabolically active. I'm not sure why, but it seems to be not as metabolically healthy. Um, so I would say, like, if you're, I would aim to try to not stack at night. But, and that again, like, I don't know if, sometimes some people need to get more calories. So if that was the case, I would say snack away. But yeah.
Once again, hard to make blanket recommendations
Yeah.
for
Yeah.
everybody, but we do the best we can. Sort of going along with that, or at least a little bit, what part do emotions play in food choice and how to be aware? Yeah, something that many of us struggle with is eating feelings. I certainly struggle with that. So,
Yeah, there's whole lines of sort of medical study that look at that. So yeah, I think that definitely is true. I see a lot of recommendations to sort of avoid the foods that you really like during chemotherapy, because you might then sort of develop aversions to them later. So that I think I definitely think that people can develop a food sensitivity, almost like if, like, say you just had an argument with your best friend and you eating strawberries. I think we can have some food memories. So I think that's like an interesting thing. But yeah, definitely, there's emotional eating, like eating for comfort. I mean, so there's a lot of packed into that. So I think they do have a big role.
I agree.
And I think also, but food could be, so emotions can be related to food, but food can be related to your emotions too. So,
Like, what foods do we use to celebrate? What foods do
but I
we
think also we could feel better when we eat healthier too, right? So we could just have better.
read? So maybe just sort of mindful eating and sort of noticing what emotions are present. Um, at least for me, that's been helpful, that sometimes I recognize that I'm sad and I'm eating because I'm sad,
Right.
and being gentle with myself for eating my sadness sometimes.
Yeah.
It's a
Yeah.
step.
Yeah.
All right, let's see. Regarding the weight gain, is it common for any weight loss with diet and exercise changes? Or at least that was dropped in the chat. I think it was in reference to talking about menopause.
So sorry, the question.
The way it was framed, like menopause related weight gain,
Mm-hmm.
common for any weight loss with diet and exercise changes. Hmm.
Yeah, so exercise, I mean, and if exercise, I'd really recommend, so the American College of Sports Medicine recommends for everyone at least 2 days a week of weight bearing resistance exercise. And really important, and I think the great thing is that if you haven't been doing it, you're like you can notice difference fast. But doing exercise to build muscle, that can help metabolism, and it can help somewhat with the shift of, because there is this sort of body composition shift too that happens. I get everyone on a body composition and I'm looking at their muscle mass mostly. That's what I'm most interested in because it sort of is a marker for health.
So weight bearing resistance based exercise
So like,
twice a week, you said?
yeah, so exercise that builds muscle is called resistance exercise. So I mean, it can be weights, it can be bands, it can be using your body weight. So it's muscle building exercise. And the American College of Sports Medicine has a great website that is actually, you can go to too and look for recommendations. So that, and then, endurance or sort of cardiovascular exercise is also included in recommendations, but at least 2 days a week should be muscle building.
Okay. Tall order, but important. What if so this is, I think, from the part of your presentation about menopause. What about if you've had a hysterectomy but still have the hot flashes and weight gain? I think it was maybe in relation to,
The hormone therapy, you mean?
yeah, maybe that was it, hormone therapy.
Yeah, I mean, typically depending on the cancer, I mean, and you know, for most women who have had breast cancer, hormone therapy is not an option. I mean, and typically they're on anti-hormone therapy. Um, so I'm not sure what for the treatment of menopause, I'm not sure what the question is really.
Yeah, well, there's another question that just came into the chat about just the predominance of hot flashes and how disruptive they are to sleep, how disruptive they are to life. Some medications have been tried and have been ineffective. This person does not want to take any more drugs. Breathing exercises aren't working. Help, please.
Yeah, so it's intense, right? So, and especially like the first few years. So the first few years of menopause are the worst for hot flashes and the vasomotor symptoms. So typically, I mean, hormone therapy is probably not an option. I mean, there are newer medications. You said that's not an option either. Um, cooling meditations, cooling clothes, the layered keeping the fan. I mean, so there's all of those recommendations on top of, there are supplements. What I would be, you would definitely have to have a conversation with who your provider and what medications you're on. But something like Remifemin, you could try, it's it works for some women. And so that would be something, um, other, I'm kind of getting down, I'm exhausting my list. So yeah.
So talking a bit more with somebody who is your
Yeah, and maybe talking with a menopause specialist. There are menopause specialists that who really, and you would have to find someone really like who was a certified menopause specialist, but they could be able to help too.
and we have those folks locally? Would you just search for a
I believe
certified
there are, yeah.
menopause specialist?
Mhm, mhm,
Okay,
mhm.
ask
You can
me.
look for providers too on the Menopause Society does have, I would say, like sometimes I've seen sort of certified providers who are, influencers who I'd be like, that is really against the guidelines. I'm not, but there are menopause specialists. So this sounds like pretty challenging case.
Yeah, I'm so
Yeah.
sorry you're going through that. Can you name any diet that results in sustained weight loss for longer than 5 years? It feels like even quote unquote successful losers eventually regain weight unless they engage in progressively disordered behaviors to maintain.
Yeah. I mean, weight loss is really complex, and so I think, if someone tells me I've tried every diet, they have tried every diet, and that's probably not a modality that's going to work. I would work, then we would focus on healthy diets, and then, and I mean, if they're on the healthiest plant-based, plant predominant diets, we'd work on exercise, making them the healthiest they can be. But and depending on what people feel comfortable with, there are medications or programs. So there actually are also, there are certified specialists who deal with that. So like that also may be a challenging case. So that I might recommend.
Okay. There were then a bunch of questions related to sugar.
Mm-hmm.
People were curious about added sugar versus natural sugar from fruit
Mm-hmm.
or in fruit. And there's some confusion about discussing sugars in fruits. Doctors say to add 5 daily servings of fruits to the diet, but fruits have lots of sugar, right? So that's the first part of the sugar related questions.
Yeah, so it's really fruits and I like to say vegetables and fruits, so 5 servings. So if I misspoke, sorry. But the 5 servings of vegetables and fruits. And, I would say like more and if you could get more, great. And more vegetables. So I kind of like 2 fruits and the rest or, you know, 2 fruits and the rest vegetables. But fruits do have natural like fructose and sugars in them. But the really cool thing about vegetables and fruits is that they have this whole network of fiber. So they've got that, and so the sugars are sort of all embedded in there, and then they have all these vitamins and phytonutrients. So they have that. You might get some calcium. You might get other things. So they have all these added benefits. And because it's sort of in this fibrous network, it's absorbed slower, and it really doesn't have the same effect that added sugars do. So.
That makes a lot of sense. Folks were also curious about whether honey and maple syrup have the same effect as refined sugar in the body.
Yeah, so yes, they're natural. I mean, they might have like, a hint of nutrients in them, but they pretty much have the similar effect.
Okay.
So
So still sparing,
yes.
sparingly. When drinking coffee by adding honey, does it help lower your cravings for sugar when you're having an episode of hot flashes?
So when drinking coffee and adding honey, not that I would have known, and interestingly enough, that um, coffee and tea is one of the major sources of sugar in the U.S. diet. So just to, you might want to try to wean that down a bit.
Okay. Let's see. All right. Okay. In reference to protein powder and supplement use, what do you recommend to help meet protein goals for vegetarian diets, which you did sort of go over a bit.
So
But maybe,
protein goes in a vegetarian diet? I mean,
yeah.
tofu, tempeh, um, legumes, nuts. I mean, quinoa, bread. I mean, everything has protein, and it's all complete, by the way. Like that's a myth. Like, you know, vegetarian proteins not being complete. So they're complete. Yeah. So I, quickly added up the protein, and I was amazed about how much I was eating, not trying. So, uh, yeah. So legumes are great. Yeah, there's quinoa.
So there is no such thing as an incomplete protein then?
No, no. So, well, there was this that started, I don't know when, but it seemed very hippie-ish kind of. But the thought was that you needed to eat beans and right, like to complete a protein. That vegetarian protein was not complete, but we don't have to don't worry about that. And a great source for that, if you want to, great videos, great YouTube videos. Christopher Gardner, he's a nutrition expert at Stanford. He is amazing, makes amazing YouTube videos, great educational. I've seen him lecture many times. He's fantastic.
Gardner or Gartner
Gardner, yeah, Christopher Gardner at
at Stanford?
Stanford.
I'm writing this down.
Yeah, it's great.
At Stanford. Because as a longtime vegetarian, this is very helpful to me as well.
Yeah, yeah.
So many good questions, all of you. Thank you. All right. Next, thoughts on creatine use for women and its link to, if any, to cancer metastasis.
I don't recommend it. I don't know about a link to cancer metastasis, but I typically don't recommend it. Yeah. So, and the data for bones was, I think it's touted for bone health and for other things. I don't recommend it. And and as I said too, I don't really recommend protein powders. I don't recommend very often either.
Okay. Can you talk about phytoestrogens and soy
Oh,
for
like
estrogen positive breast cancer? Should
yeah.
they be avoided?
Yeah, so I think like decade ago, I remember seeing a pamphlet, I kid you not, and it had like a little, no soy, like, and um, women were told not to, with breast cancer, were told not to eat soy, or they told that soy would cause breast cancer. Well, it turns out that's not true. We have large, large studies of women eating soy. And in fact, when we look at if you look at the women eating the most soy, so women with breast cancer, estrogen positive eating soy, the women who had more did better, and so you could look on MD and all of the big cancer centers. They all have pages that say it's okay to eat soy. So
Okay,
yeah.
great. That's
So a
really
phytoestrogen is not really estrogen. And so, I'm also like, I'm going to put a plug in younger women. It's a great time if they're not eating soy to introduce it too. So it's thought to be helpful in preventing cancer. So our daughters, our granddaughters, also preventive and helpful for prostate cancer. So great for men too.
all
Yeah.
right.
Yeah.
My toddler likes tofu, so I will recommend it.
Fantastic. Yeah.
Little people like it too.
Yeah.
All right. What research is being done to help reduce risk, specifically for those with BRCA or other genetic mutations? What advice do you have specifically for this population?
So for, I mean, I'm previvors and survivors. I think that that's an interesting group, because I think that there, other than there's cancer risk, but there may be other risks too of, you think about, you have these genes that have to do with DNA, like would they, are they at risk for cardiovascular disease and other things? So, yeah, I think, I mean, in general, diet wise, I don't have a lot of other recommendations. I think we're at screening. Screening, I mean, there are, well, screening, but healthy diet and I will say, like, I have been doing this for 15 years, and supplements were exciting, but I would say I see, many more results from diet and exercise. And I mean, I was just amazed the other day. I had a patient with CLL who she started a plant-based diet. And I'm not saying that this is the treatment for CLL, but I'm just saying the response, like her counts, like we were both amazed. And the only thing we could attribute it to was her change in diet. And I'm not saying like this is just one antidote. That's not great evidence. But what I'm saying is that I, it's not small, the effect of diet and exercise. Um,
And there are some like longitudinal studies that are being done. I know MD Anderson is one source of longitudinal studies about those sorts of lifestyle changes and how
yeah,
they affect
yeah, yeah.
outcomes. So let's see. Is there a recommended diet or foods to focus on to help aromatase inhibitor induced and arthralgias or joint pain? And you did mention turmeric, and there was something else that you mentioned for
Yeah.
joint pain, but I couldn't remember as I
Right.
was.
I mean, for diet, an anti-inflammatory, so Mediterranean plant-based diets are anti-inflammatory diets. They're full of, whole foods. They have omega-3, getting enough omega-3 fatty acids. In women with aromatase inhibitors, there are some things who are having joint pain. I mean, certainly there are some, exercise and some physical things that can be done. There are a number of supplements that I use. My first go-to, I mean, in this case, is fish oil. And so high dose fish oil I will use in women who have joint pain. There are some studies, it has like a disease, like in autoimmune arthritis, that it can be helpful. And so, and people could do algae oil if they're vegan, could try that. So that would be my one thing. So an anti-inflammatory diet really is, whole food, plant-based, or a Mediterranean, they are anti-inflammatory diets. So
I will put a plug too for our Surviving and Thriving on Aromatase Inhibitors program for anybody who's struggling with an
yeah,
aromatase inhibitor and all of the side effects
yeah,
associated therein. It'll be offered through the coalition 3 more times this year. So
nice. Yeah,
shoot us a message or give us a call.
yeah.
All right. In Talk About Strength Training, someone just started the Live Strong program at the YMCA and was just diagnosed with a partially occlusive blood clot in the right leg. Should any exercise be avoided in general with a clot?
I don't know if I can, I mean, I would talk to your physician about that. I mean, I certainly at some point I think you can. I don't know, like, how long. I couldn't answer that specifically, but.
Tough one. And I'm sorry to whoever is dealing with that.
Mhm.
All right. When reading nutrition labels, ooh, this is good. Is all the calcium listed on a nutrition label bioavailable?
Well, so no, no, yeah. um, but but the recommended amount is not like, so say there's 100 milligrams and it's 50% available. So you're going to get 50 milligrams, but you don't have to increase your total intake because it's like, you see, like it's going to assume for that, because even supplements are not 100% bioavailable.
Yeah.
So you see what I'm saying? So you take the recommended amount on the label, but no, I mean, you don't have to worry about it, but yeah, just know that you wouldn't have to worry about plant calcium. I think some people are really worried that they're not getting enough from it, but they can actually get more per volume because it's more
Oh,
available. So if you were recommended a fat like 1,200 milligrams and your label said 300 milligrams, well, you would count that. You wouldn't say, oh, I'm only getting like 50% of this, and so I need to eat more. You see what I'm saying?
I
Yeah.
think so. So
Yeah.
even the recommendation of the 1,200 is taking into account the fact that not all of that 1,200 is going to be
Yeah, it's already
bioavailable.
taken into account, right? Yeah.
Okay.
Yeah. Yeah.
Okay.
Yeah, you
Because
don't have to
otherwise,
think about the vibe, but yeah. But I think that, and why I pointed that out is just that some people felt like the only thing they could eat was dairy, but turns out that you can get it in a lot of great sources.
okay. And there's no need to know what percentage of something is bioavailable because
No.
that's a lot of knowledge to keep in your head and a lot of math
Yeah.
to keep doing
Yeah. Yeah.
as you're trying to eat. Okay, so basically, don't worry too much about it and the calculations and such.
Yeah.
Enjoy your meal. All right. Uh, well, this is a tough one too. What is the best vitamin D supplement?
Oh, I mean, I think typically I recommend something. Um, it depends. I mean, so you want like a little capsule that's like instead of a tablet, and most of them are like little gel caps because it's a fat soluble vitamin. There's tons of products out there. It's hard to say which one is the best.
You did mention that seeing a third party testing.
Yes, yeah. So, and, there's products that I become familiar with or that I like. I mean, but vitamin D, it's pretty, it's out there. So, yeah, look at the label, make sure it's third party tested. It will have little seals on it.
Okay. Yeah, it's like the Wild West for supplements out there. Is melatonin safe for sleep?
Yeah, yeah, melatonin is safe for sleep.
All right, that's an easy one. Okay,
Yeah.
we're getting to the end here. What about vitamin C supplements? What do you think about vitamin C infusions?
Yeah, interestingly about vitamin C infusion. So supplement and infusion is totally different entity. So supplements, I typically recommend no more than, I mean, some people really are deficient and some people have trouble absorbing. So, adding some on, not during therapy and treatment though, but, about 500 milligrams, it seems to be as much as you can absorb at a time. The idea of IV vitamin C is at very high doses and it has a very different effect. And it was used, let's just say, like, I talked to a number of practitioners who've done thousands of these. So one of the doctors at Bastyr, another at Kins. I think people just felt like they didn't really see great results with that. There are small little studies looking at it during treatment for pancreatic cancer, treatment for ovarian cancer alongside. And so that, maybe, reasonable with the right, person and the right practitioner. I would say though, it's very hard to do and to get a good quality IV vitamin C because vitamin C is so readily breaks down. It should be like added right into the bag at the time of the IV, but it comes shipped, and it's like, because there's laws about compounding. So I don't think like what people get is very useful. That's my take on IV vitamins. I don't think it's worth it.
Okay. And I think we're like the last maybe 6 questions.
Sure.
So, maybe 7. Since you mentioned it, what is a good supplement for someone coming off a proton pump inhibitor?
Yeah. Yeah, so I like have a really, if someone's coming off and I'm guiding, and it's under guidance, we're working together. I like to use things like, it's called diglycerized licorice. There's a product, my husband is a physician as well. So in his practice, he's an ENT doctor. They're using a lot of, it's called Reflux Gourmet. That I'll just put that out there. They're seeing great results. But I like to use what's called DGL. It's called diglycerized licorice. It has the glycyrrhizin taken out of it. So that's the part of a licorice supplement that can be harmful for some people. So I'll use that in sort of a tailored kind of taper, and in certain people who, so yeah, I can't really make specific recommendations for people to get off there, but
Yeah,
I can do it for, yeah.
things to look into.
Yeah.
What do you think about Prolia shots and calcium?
Oh, sometimes, I mean, I'll get back to that person on that one. But, typically, like if you're bone building, and the osteoporosis medications, generally you do need calcium, adequate calcium. So you need adequate calcium with osteoporosis medication. However, some medications can actually really increase calcium levels. So those people do not need it. So I'm really not sure the answer to that one.
So it's a case-by-case basis.
Yeah.
Okay. After I was diagnosed, I was told by my surgeon that I should not eat any pork at all in any form. Is that correct?
Yeah, I'm not sure. I don't know why.
That seems,
Yeah, that's, I mean, I'm curious. I mean, I don't, I wouldn't recommend eating pork. Like I don't, but I'm not just that specifically. It's curious. I don't know why.
yeah, so any blanket,
Yeah, like usually it's meat, yeah, or animal products, but yeah.
does seem like an odd, yeah, boundary to set.
Yeah.
If I have diverticulitis and can't eat nuts, what proteins can I eat? Beans also I can't eat. I don't eat meat, only fish.
Um, I mean, so I'm not this person's gastroenterologist, but recommendations have changed regarding diverticulitis with nuts and seeds. So typically, like that's something that has changed. So I don't know, they would have to, talk with their gastroenterologist. So that might not be an issue. Things like nut butter could be. I don't know why the beans not. Sometimes people are very gassy with beans and lots of fiber. And in that case, they tend to avoid it, but I would say just kind of go slower, like just work on it slowly, because it's that microbiome that sort of has, you actually need to get used to it. Yeah, so and some beans are less gassy than others, or difficult. I mean,
What are the least gassy beans?
so, and I think it depends on people, but I think chickpeas are notorious, sometimes they can be notorious for being gassy, but like some white beans, and I think if they're cooked longer, I like to soak them. And I don't know if there's any science to this, but I use a kombu. It's called kombu. It's like a seaweed, and it
Mhm.
seems to make, so, and kind of go slow, I think.
So you boil them in kombu?
So when I cook dry beans and I boil them with a strip of kombu. It's a seaweed, and it
Yeah.
seems to help. Yeah. Yeah.
You can get that at your grocery store.
Yeah, at Lori's, they have it at Lori's, so
Okay.
you can get it there. I mean, tofu, I mean, is a, it's a nice protein source, I was surprised. So that's silk milk again, 7 grams of protein, Ezekiel bread, protein, peanut butter, protein. So
Yeah. Okay. I have received so many recommendations from everyone and their neighbor about what I can do to heal my body.
mhm.
Frustrating. I asked my oncologist if any of what people are telling me is true. How do you recommend sorting out the lies?
Yeah. Well, hopefully I helped a little bit. um, I think people are well-meaning, and just to, generally they're not oncologists and they're not generally not trained, and so they'll pick up little pieces of information. It's sort of to kind of let it, I don't know. I sort of sometimes think, well, it's a kind gesture, but just let it kind of go through. Um, One, you can talk back to your oncologist, the American Society of Clinical Oncology, the Society of Integrative Oncology. I mean, uh, there are numerous websites, MD Anderson, Sloan Memorial, they have good data. If you want to query the data, put it into PubMed plus ASCO plus, look for large studies, look for, you know, human studies. And, often I'll see people get recommendations and, even sometimes practitioners can do, they'll equate, a treatment for lung cancer. Well, you should do this for someone with breast, and they're almost two different, totally different diseases. And so, I think people are well-meaning and that just might be their way of showing they care. It can be frustrating for sure.
Yeah, there's so much free advice out there.
Yeah,
Comes from a place of love and care, but
yeah.
if it can just roll off like duck on or like water on a duck's back, there we go. Okay, 2 more questions. Can some foods reduce estrogen in women?
Uh, I don't know. I mean, there's certainly the, uh, I don't think so. I don't think so. I certainly think like there are foods that can help us so we process our hormones. We detoxify everything in our body every day. And so I think there's certainly foods that can help with that. I think foods with fiber and lignans can also help us metabolize that. I mean, I'd be curious. I'm not saying I don't know, but I don't know of foods in particular that can lower estrogen levels.
Okay. And then lastly, is there a good or one that you would recommend? Whole Foods Plant Forward Cookbook that contains meal plans.
Yeah, I mean, I use off the top of my head, I don't a cookbook, but I love the website Love and Lemons is a great one, and oh, the other one, oh, there it's Half Baked Harvest. No, uh, I can actually send them, but I often use the New York Times. Just I'll Google that, or well, I do love a cookbook that I love is called Cool Beans. So it's all about cooking beans. It's fantastic. It's called Cool Beans. That one is one of the ones I use a lot. I like to cook. Um, I think it's called The First Mess. Let me just, that's the one that I'm thinking about.
The other website you're thinking about?
Yeah, not Half Baked, but it's called The First Mess. That's yeah, vegan. They're vegan recipes. It's called The First Mess.
All right. That's really great. Well,
Great.
I think we got through everything. Thanks to everybody who's been able to stick with us. Thank you, Dr. James,
Oh,
for
yeah, it's my
sharing so
pleasure.
much time and answering diligently all of those questions. If anybody has additional questions, feel free to email them or call, and we'll do our best to share with Dr. James. But also, just to remind everybody, there's going to be a little survey that pops up. Please give us any feedback. Add those questions that you might still have into that survey, and we'll do the best we can. And hopefully we'll see each other again in, the coming days, weeks, months. Please stay well. And
Great.
thanks again.
Thank you. Right.
Take care. Bye-bye, everyone.